Hafide Guam, and welcome to ExpressCare Aganya. I'm excited today to present to you a new procedure that we're offering at the clinic called PRP, platelet-rich plasma. What it is that we're going to take the patient's blood, spin it down, take the best parts out, and put it back in their face in order to help them rejuvenate, get rid of scars, and overall improve their appearance. The beauty of this procedure is that it's totally safe because it's their own blood, and we like to call it the vampire facelift because Halloween's coming up. What Jen's doing now is she's putting the blood into the special test tube along with the medicine that's going to activate the platelets. Now our patient's blood is down in there, all ready to spin down and separate. So here we've got the magic ingredients that are going to help our patient's skin. We're going to take them and go centrifuge the blood now. The blood components have gone down. These are the solid components, the red blood cells that oxygenate your blood, the white blood cells that help you fight infection. All of this is down here. But the little platelets that spin around and help your blood clot and also help you heal are right in this area here. Up top, the yellow is plasma. That's the liquid part of your blood that has all kinds of wonderful ingredients too. Goes around your system, releasing them, helping you heal in all other parts of your body too. So we'll use that also. But our best part is the platelet-rich plasma, this cloudy fluid right in here. We're going to focus on the little crinkles and lines that she's got down here, a little bit of scarring, the lines that she's gotten here, and the hollowing that we get as we get a little bit older. So we're going to start with a small syringe here. This is really very straightforward. We've had numbing cream on for a little while, and she's been applying ice so that there's really very little pain. It will sting a little bit, but she'll be okay. So we're just going to have you apply a little bit of ice just right over here. There you go. That's perfect. Okay, just relax. I'm going to just inject it right along the line of her wrinkle here, the fold line. It's going to sting just a bit. There you go. You're doing super awesome. Excellent job. Okay. And it does sting a little bit. Just put a little bit of ice right down here. Here? Yeah, thank you. Just gets a little bit pink, and it does sting, but she's doing great. Vampire things can't be painless completely. And we're doing great. All right, perfect. Okay, just keep breathing. There we go. All right, just putting it right in down here, filling in areas that need just a little bit of help, or there's fine lines. Perfect, perfect. Okay, it's just getting a little bit pink, tiny bit puffy. That's great. Yeah, and we'll just do it right on the other side also. Great, excellent, perfect. Okay. Just going to put a little bit of cream here that's going to help for a little tiny bit of bruising or bleeding that could happen. Rarely does. Going to go right down in over here again, filling in. And what we're doing is we're putting that platelet-rich plasma right back into your face so that your own growth factors can rejuvenate, help the face look younger, fresher, get rid of any scars, blemishes. There we go. Stings a little tiny bit. You're doing great. Perfect. Excellent job. Okay, so she doesn't really look different. She's just pink and a little tiny bit right up here. Perfect. Okay. Great. Excellent. You can see there's minimal blood at all. Okay, so while we are vampires, we're not sucking too much blood out of you. Okay, there you go. There you go. Okay. We're going to use the best part of all of the platelet-rich plasma in the area that can really use it the most, which is right under the eyes. As we get older, we get tiny little crinkles, we get eye bags, we get puffiness. All of this can be improved with her own blood. So So we're going to just shoot it right in underneath here. It's going to sting a tiny little bit. She's doing great. Okay, perfect. You're doing amazing. Okay, it's going to just sting a little tiny bit. You're doing great. Putting it right into the little thin skin to thicken it up right under the eyes. Perfect. Now we're going to put a little bit of cream and a lot of ice. Just putting a little bit right in her forehead lines. Perfect. That one didn't even hardly bleed. Okay, so the last little bit we're going to do on our patient here is just the little lines that we get here from smiling on the side of our face and a little hollowing. So right in here we go. She'll still look slim and beautiful, but the lines won't be there, just like when we were younger. You're doing great. Last little bit right over here. Just fanning it around. Perfect. The procedure is complete now on our patient, and we're just going to apply a nice collagen mask to help calm down the redness in her face. You can see that she really doesn't look too bruised or bleeding or poked up or anything. She'll be able to return to her normal activities in the next day or so. She can wear makeup immediately, and most of the swelling and redness will be gone by tomorrow. And the effect of this treatment is going to be most visible about 3 or 4 weeks from now, when that blood has had a chance to do its work, where all the platelet-rich factors that have been put back in her face have had a chance to start rejuvenating and healing her skin. Thanks for joining us today.